Do you ever feel out of breath after going up just a few steps? Or maybe your legs hurt and are stiff, and you've noticed that your feet are usually cold even when it's warm outside. These could be indicators of something worse than just getting older. If you have these symptoms, you might have blocked arteries in your legs. This is a common problem for older people. But what if it were as easy to check for blocked arteries as a short test you could conduct at the doctor's office? You won't have to go through any complicated procedures or intrusive examinations. Just a simple checkup that could keep you from having major cardiac problems in the future. Stay with me because I'm going to show you how to find blocked leg arteries before they become a big problem in the following few minutes. If you're new to the channel, be sure to subscribe. We're here to assist seniors improve their circulation, protect their hearts, increase their memory, and stay healthy and independent by giving them useful ideas, natural cures, and lifestyle changes. When you sign up, you'll get weekly advice that will help you live a better and healthier life after 60. Let's get started. What is PAD and how does it hurt your legs? Let's talk about peripheral artery disease, PAD, first. This happens when the arteries in your legs are narrower or blocked because plaque made of fat, cholesterol, and other things builds up in them. This plaque slows down blood flow, which can make your legs hurt, cramp, and even go numb at times. But PAD doesn't only affect your legs. When your arteries in your legs are blocked, it can mean that there are problems in other parts of your body, such as your heart and brain. Your leg muscles don't get the oxygen they need when blood doesn't flow properly, which causes pain and tiredness. If you don't treat PAD, it can lead to more serious health problems, like heart attacks, strokes, and possibly the need for amputation if the tissue in your legs dies because it doesn't get enough blood. The good news is that PAD may typically be controlled or even reversed if it is found early. Old ways of finding PAD. A thing of the past. For years, doctors had to use intrusive methods like angiograms to find PAD. They had to put a catheter into your blood vessels to capture pictures. This operation is not only painful, but it also takes time to heal and has some hazards. This is why a lot of older people wait until their symptoms get worse before getting checked. But here's the good news. You don't need to have intrusive tests to see if your arteries are blocked anymore. A simple, rapid, and non-invasive test is now easier and faster to find PAD thanks to advances in medical technology. The ABI test for the Ankle-Brachial Index, a game changer. The Ankle-Brachial Index, ABI test, is one of the best ways to find out if you have PAD. The ABI looks at the difference between the blood pressure in your arm and the blood pressure in your ankle. If the pressure in your ankle is much lower than in your arm, it implies that blood flow to your legs is limited. This is an early indicator of PAD. This test is rapid, simple, and gives results right away. It's a game changer for older people who wish to catch PAD before it causes major problems. You can usually get the ABI test done in your doctor's office in only a few minutes. It's an easy, cheap method to feel better without any pain or extended recuperation durations. Now that we know how PAD affects your body, let's talk about why it's so crucial to find it early and how changing your lifestyle can make a major difference. Why it's so important to find out early. Getting PAD early can make a huge difference. The sooner you find out you have the illness, the sooner you can do something about it to stop it from getting worse. Getting therapy early can help you avoid more serious health problems, such as heart attacks, strokes, or the need for surgery. Here's why. When your arteries are blocked, your organs and tissues don't get enough oxygen, which hurts them over time. But if you discover PAD early, you can adjust your lifestyle to enhance circulation and lower the chance of problems. How changing your lifestyle can help with PAD. Exercise is the most critical modification you can make to your lifestyle to help with PAD. Walking every day has been demonstrated to enhance circulation and lessen the symptoms of PAD. Walking for just 30 minutes a day will help your arteries open up, which will send more blood to your legs. But it's not just walking that helps. Strength training and stretching can also enhance your circulation and ease some of the pain caused by PAD. But you might not realize this. Diet is really important for controlling PAD. Eating the appropriate foods can help maintain your arteries clear and healthy, and what you eat can have a direct effect on the health of your arteries. Foods that help keep your arteries healthy. Some meals are especially good for your heart and arteries. Fatty fish like salmon and mackerel, as well as walnuts and flax seeds, are good sources of omega-3 fatty acids. These acids help lower inflammation and stop plaque from building up in your arteries. These good fats not only help your blood flow better, but they also lower your blood pressure, which is another important way to avoid PAD. Another superfood for your arteries is garlic. Studies have shown that garlic can lower cholesterol and inflammation in your arteries, which makes it simpler for blood to circulate. Adding garlic to your food or taking it as a supplement can be an easy approach to make your heart healthier. There are also dark leafy greens like kale and spinach. These are full of nutrients including magnesium, which keeps your blood vessels flexible and helps blood flow. Adding greens to your meals can help maintain your arteries healthy and minimize your chance of PAD. It's time to clear up some prevalent misconceptions concerning PAD. A common fallacy is that only those who smoke or eat poorly get PAD. PAD can happen to anyone, even if they smoke or eat poorly. Genetics, diabetes, and high blood pressure are other big risk factors for PAD. This means that even if you live a healthy life, you should still get checked for the disease. Another fallacy is that PAD mainly affects the legs. PAD is generally a symptom of a lot of vascular disease in the body. If your legs' arteries are stopped, it could mean that the arteries in your heart and brain are also blocked. To preserve your health, it's important to get treatment for PAD as soon as possible. What should you do if you think you have PAD? Don't wait if you suspect you could have PAD. Talk to your doctor about getting an ABI test or another test that doesn't involve cutting. Finding out about a problem early is the best way to avoid catastrophic problems, including heart disease, stroke, and amputation. It's easier to deal with if you catch it early. Let's go over it again. The Ankle-Brachial Index ABI test makes it easier than ever to check for clogged arteries in your legs. Finding out about a problem early can help stop catastrophic health problems, including strokes and heart attacks. You may help maintain your arteries clear and your body strong by making some changes to your daily life, such walking more, eating foods that are good for your heart, and managing stress. Please like, share, and subscribe if you thought this video was helpful. By signing up, you'll get weekly recommendations developed particularly for seniors that will help you live longer, healthier, and happier after age 60. Have you seen any signs of PAD? What adjustments to your way of life have aided your circulation? Please tell us in the comments below. We'd love to know how you've been taking care of your health and what has worked for you.